Welcome to Arirang TV's continuing coverage of COVID-19. I'm Min Son-hee. The global tally of infections stands at more than 22 million. In a span of a week, the world has recorded more than 2 million cases. And it is precisely this shocking speed of spread that have authorities here on high alert as they race against time to contain what appears to be a fresh and rapid outbreak. We start now with the latest numbers with our Kwon So-ah and related news with our Hong Yu. So I understand Korea is still in the triple digits on this Tuesday.
Yes, Sunny, we are back from the extended weekend, which was unfortunately not as pleasant as people could have hoped for, especially in the metropolitan region. As you just said, we're still in the triple digits.
Right, so and I hear that the majority of the cases are linked to places of worship.
Right, and in particular, infections traced to the Sarang Jeil Church and its worshippers' attendance at a massive rally over the weekend. And that is why health authorities are calling on its members to get tested for the coronavirus as fast as possible. And also, as we can see, the leader of this church has been tested positive for the virus on Monday. So how many cases are we looking at this Tuesday? We have 246 new cases, raising the total to 15,761. The death toll stands at 306 as we have one additional death, and 228 people have been quarantined in the past 24 hours, and we'll have 17 new recoveries. Now, out of the 246 cases this Tuesday, we're seeing 132 in the capital Seoul, 52 in Gyeonggi-do province and 18 in Incheon. And these cases in the metropolitan region are also spreading sporadically to other places in the country. Meanwhile, Korea also reported 11 imported cases today, with 6 of those detected at the nation's airport or seaports. And now let's go over to our graph here. We see since Friday, we are seeing numbers in the 3-digit figures for 5 consecutive days. And especially on Saturday, we had an alarming jump. We went down to below 200, but again, now we're back at over 240 cases.
Right, so I hear, though, that Korea is not the only country that's seeing a resurgence in cases. This is a global trend, right?
It is, Sunny. There is a second wave of infections in many places around the world, including in Europe, Spain, and France. And even in New Zealand, cases are growing, which actually recently have been touted for its containment measures, and it had 0 cases for over 100 days. So these new resurgences are really not helping in getting a slowdown of the global figures, which are now at over 22 million in total, with over 777,000 fatalities and roughly 14.8 million recoveries. Now let's move over to our major outbreaks across the world. The U.S. is seeing a slowdown in daily cases, but still here at 5.6 million cases, and followed by 3.3 million in Brazil. And India recently had its highest single-day death toll at over 900 just on Sunday. And as I was mentioning, resurgences, if we go over to our next table, we have Spain here at more than 382,000 cases, which reported some 1,800 new cases in the past day. And those are the figures I have for now, but I'll have more updates after the government briefing. Back to you, Sunny.
All right, so thank you for that. I'll see you back at the desk. Meanwhile, North Korean leader Kim Jong-Un was recently seen at flood-damaged areas of the reclusive country to oversee relief efforts in the aftermath of torrential downpours that flooded thousands of homes and farmlands. For more, I have our North Korean affairs correspondent Hong Yu in the studio. Welcome, Yu.
Thank you for inviting me.
Now, before we touch upon the flood damage, perhaps we could talk a little bit about the COVID-19 situation in North Korea. I hear lockdowns have been lifted in the city of Kaesong, Yu.
Yes, honey, lockdown in Kaesong has been lifted on Thursday, 3 weeks after the city was completely sealed off. The lockdown was ordered after a North Korean defector from the south allegedly returned with symptoms of COVID-19. The decision to lift the lockdown came during a Politburo meeting, during which Kim Jong-un emphasized the importance of strengthening the North's virus containment measures. Relevant prevention guidelines are broadcasted around the clock through its state-run Korean Central News Agency. KCNA news clips showed checkpoints set up near borders and provincial boundaries where vehicles are sterilized and drivers are checked for their temperature. Like everywhere else in the world, people in North Korea are wearing masks and being asked to wash and sanitize their hands often. The KCNA says North Korean medical personnel have been supplied with all medical equipment they need and have been trained to respond quickly to any suspected cases. But the regime continues to remain tight-lipped on how many test kits they have and how many people they have tested so far.
I see. Now, as we mentioned, North Korea is also dealing with the aftermath of recent floods. How serious is the damage there?
Well, Sunny, heavy rainfall early this month has destroyed around 390 square kilometers of farmland and has damaged around 16,680 homes, as well as 630 public buildings. The International Federation of Red Cross and Red Crescent Societies said 22 people have died and 4 are still missing. In response, many international aid groups and South Korea have expressed their willingness to support North Korea in its relief efforts. Let's take a listen to what the Unification Ministry said regarding aid to North Korea.
We will continue to promote humanitarian cooperation regardless of the political climate in the event of a natural disaster like this latest flood. We are now analyzing the impact of the flood on North Korea.
But the regime says it won't accept any foreign aid over fears of COVID-19 entering its borders. During a Politburo meeting on Thursday, Kim Jong-Un said the North will keep its borders shut and redouble efforts to prevent the spread of the coronavirus. In the first week of August, North Korea got more than 850 millimeters of rain, almost as much as the annual rainfall of 960 millimeters that they see in a typical year.
So how is Kim Jong-un maneuvering himself politically amid these challenges,
Well, Kim Jong-un is portraying himself as a benevolent leader, a leader who puts his people first above all. And he even drove himself in an SUV to a flood-damaged area in rural North Korea, which was the first time he was ever seen behind the wheel of a car. Experts say this is a calculated move to bolster his image as a leader who takes personal initiative to help his people in need. Photos of Kim show people welcoming the arrival of Kim Jong-un as he gets off his car covered in mud. Not only that, but Kim also ordered the release of special aid for the citizens of Kaesong during its lockdown. Over 550,000 relief items in more than 30 categories, including food, were sent to Kaesong while the city had been sealed off. Kim Jong-un may be trying to appease the public with the pandemic and international sanctions taking a heavy toll on North Korea's economy. Plus, for the first time in 2 years, the regime is granting pardons for criminals starting from mid-September. The regime said the government has the responsibility to take care of all of its citizens and will take efforts to reform criminals and help them readjust to society.
I see. I understand there was also a minor reshuffle in the upper levels of the North Korean regime. What can be gleaned from these new appointments that came last Thursday, I hear?
As you mentioned, Sunny, during the Politburo meeting, North Korea appointed the Workers' Party's Vice Chairman Kim Duk-kun as the new premier of the cabinet and Lee Byung-chul as the new Politburo member. Kim Duk-kun is best known for being an economic expert, and Lee Byung-chul is known for his role in the regime's strategic weapons development. There are concerns that Lee Byung-chul's appointment could mean North Korea is planning to further its development of nuclear weapons and ballistic missiles. But experts say that's not necessarily the case. Let's take a listen.
Considering the current state of inter-Korean and North Korea-US dialogue, the regime intends to strengthen the Workers' Party's power and control over the military by appointing Lee Byung-chul as a Politburo member, but it does not necessarily point to a new arms buildup.
Experts say that this restructuring to a 5-pronged leadership model from the former 3 with Kim Jong-un, Park Bong-ju, 재유행의, Kim Duk-kun, and Lee Byung-chul can be interpreted as an attempt to strengthen the Workers' Party's role in the management of state affairs.
Right, Hugh. Thank you for that coverage. Hope to see you again soon.
Thank you.
Right, it's a little after 2 in the afternoon and we are poised to join the regular afternoon briefing on COVID-19. Prior to the current outbreak here in Korea, authorities had warned of a resurgence in COVID-19 cases in the autumn and now believe the event has unfolded earlier than expected. Now, the resurgence appears to be a global trend at the moment, and officials here are calling for members of the public to abide by stringent prevention efforts. Here in the Greater Seoul area, special social distancing guidelines, that is, have been raised to level 2 for the next 2 weeks, making indoor gatherings of more than 50 people, as well as outdoor gatherings of more than 100, impossible. Schools are also expected to adopt a hybrid academic approach with lessons including both offline and online guidance. Fans of football and baseball, meanwhile, are also forbidden from attending them at stadiums, while public centers, including museums and libraries, close doors. Following 103 cases on Friday, Korea noted 166 cases on Saturday. Now, the briefing is about to start. We'll come back to you afterwards.
First of all, here is Deputy Director Kwon Junuk with the explanation. Let us now begin our regular briefing on the COVID-19 situation for August 18th, Tuesday. As of today, midnight, we have 235 new local infections and 11 new imported cases. The total number of confirmed cases now stands at 15,761. 17 more people have been discharged following full recovery, and a total of 1,521 people are still in quarantine. There are 9 patients with severe or critical conditions, and yesterday we had 1 additional fatality. I extend my deepest condolences to the deceased and the bereaved families. First of all, let me begin. As of noon today, we have also some updates on the domestic infections. At the Sarang Jail Church in Seongbuk-gu District, Seoul City, we are doing our epidemiological investigation, and a total of 183 people have been confirmed, and a total of 457 have been confirmed to date. And this also will be subject to change depending on the time of the publishment of the documents. And in relation to this specific church, there are 432 in the metropolitan area, with a majority of them in the Seoul city as well. And also in other parts of the provinces, there were 25 patients in other provinces, 2 in Daegu, 8 in Chungnam, and also 2 in Daejeon, 5 in Gangwon, and 4 in Jeollabuk-do province. And this shows that we are seeing widespread of the patients nationwide. In relation to this church as well, we are seeing additional outbreak continuously. And related to Sarang Jail Church, we have Andiok Church, which also saw 15 number of cases, and also Lotte Home Shopping, they had 7 more cases. And in Nonghyap Card, a call center, 4 people, and about 2 in other call center, and 1 in a nursing care center, and also in another person being confirmed at an Amsadong nursing hospital. And we are seeing number of cases going forward, and we are conducting epidemiological investigation. And as of today midnight, we have about 4,000 people on the list that we have secured, and about we have seen the divisions of and dispersion of the regions, and majority of them are in Seoul, and also about 800 are in Gyeonggi-do province, and 77 in Gyeongbuk, and 55 in Chungnam area as well. And this shows that they are dispersed across the country, and we are highly concerned of a possible outbreak throughout the nation. And this specific church, it is very difficult for us to identify and distinguish the times and locations of their activities. And they had continuous rounds of exposure to the virus as they held different types of events. And starting from July 27th, I ask all of the visitors and worshippers at this church to get tested as soon as possible, regardless of your symptoms. Moreover, in relation to Sarang Jail Church, we also have noted that there were members who went to the public rallies in the Gyeongbokgung area and Gwanghwamun area on the 8th and 15th of August, respectively. At least 10 people have been there, and we are also concerned of a possible large-scale outbreak relation to these rallies. So we ask for the people who were there present at these respective rallies and demonstrations, we ask you to get tested as soon as possible at nearby screening clinics, regardless of your symptoms. Next, we also have more updates on domestic infections. In Gold Train, Gangnam-gu District, Seoul City, and a group meeting in Yangpyeong-gun District, we have 15 additional cases. A total of 73 people have been confirmed to date. And in relation to Daesekim Church in Yangcheongu District, Seoul City, we have one additional case. In total, we have 12 cases to date. And related to Orchestro, in Yeongdeung-Pogu District, Seoul City, we have one additional case. The total has now jumped to 8. And in relation to the Yeouido Sunbogum Church in Yeongdeung-Pogu District, Seoul City, we have confirmed the first index case on the 15th of August. We have 3 additional cases, and as of now, we have a total of 4 patients to date. And in the Jongno-gu District, Seoul City, at the Haewadong police station, we have also additional cases there after identifying the index case, and a total of 5 people have been confirmed. Moving on to the Gyeonggi-do Province, related to Uri Jail Church in Yongin City, Gyeonggi-do Province, 16 additional cases were confirmed from testing, and a total of 147 have been confirmed. Related to Starbucks at Paju City, we have 7 additional cases being confirmed. A total of 49 people have been confirmed to date. And in relation to the Jukjeon High School and Daeji High School in Yongin City, Gyeonggi-do Province, we have 2 more cases, with the total now standing at 15. Moving on to the Busan City, in relation to the National Mechanic Engineering High School in Haeundae-gu District, we have 2 additional cases. The total now stands at 17. And in Sasangu District in Yeongjin-Bolt, we have additional cases there, and a total of 4 cases have been confirmed to date. Moving to Gwangju City, related to a nightlife entertainment venue in Sangmu District, we also have 3 additional cases. A total of 17 cases have been confirmed to date. And lastly, in relation to a family in Daegu City, Suseongbu District, we also see that one person confirmed case in the Seoul Dongjagu District has visited there, and it spread the virus to family members, and a total of 5 people are in relation to this cluster. The KCDC is also announcing that remdesivir has been administered to a total of 128 patients at 35 clinics nationwide here in South Korea. And as for the public survey on the coronavirus, we have seen throughout the month of July, many people were concerned of the coronavirus spread, and we have seen that actually there was about 28 percentage points decrease in the number of people who saw that the situations were grave. And based on these awareness, we would like to mention that the COVID-19 can infect anyone at any place, especially if these places are closed, crowded, and close contact environments. So please take note of this and please abide by quarantine measures at all times. Please refrain from making non-essential visits and travels outside, and please postpone them as well. And during your routine daily lives, you may visit cafes and restaurants on a regular basis, but always wear face masks if you are not consuming food. And if you are staying there for a long time and engaging in dialogue and conversation, please note that you will be prone to infections, and these cases are developing nationwide. So if you go rather than going to cafes and restaurants, please use delivery services as well as takeout. And even if you go to these cafes and restaurants, please avoid crowded hours, and also at times of not consuming your food, please wear your face mask and also minimize your staying time. At the same time, we are continuously seeing an increase in the number of cases in the Gyeonggi-do and Seoul metropolitan area, and we have also raised the social distancing to level 2. And we also mandate restaurants with certain area, we ask them to also comply with the mandatory quarantine efforts of QR codes for entry log and also the distancing as well. And next, about the religious services and religious facilities nationwide, we are continuously seeing cluster infections in Seoul and Gyeonggi-do province. And starting from the 15th of August, the Seoul and Gyeonggi-do province have issued an administrative order to also recommend the closure of these religious services. And aside from these regular services, all of these small group meetings are banned. And also during the regular service, we ban all of the activities that increase respiratory droplets infections, including singing and chanting. And you are always mandated to wear face masks, and you cannot consume food together. And you need to also comply with the QR code entry system, and you also need to have disinfection on a regular basis, especially before and after the regular services. And you also need at least 2 meters of distance with other people within the facilities. As for some churches, we have noted that the churchgoers are spread throughout the country, and this could lead to a massive outbreak nationwide. So we advise all of the religious facilities outside the metropolitan area to comply strictly to the quarantine measures. Last but not least, we have some words of announcement. Right now, centering around Seoul City and Gyeonggi-do province, we are seeing cluster infection, especially stemming from the Sarang-Jeil Church. This is a very great concern as the number is very large. And compared to the February and March when we had a Shincheonji outbreak, the current situation is even more serious and severe. At this point of time, we are required to keep distancing measures and quarantine measures stringently, and also you need to get tested as soon as possible if you have symptoms, as if this is delayed, we will soon be also repeating these steps of the other countries like US and Europe, which saw a major outbreak, and we believe that this is a moment of which is very essential. If we fail to contain the virus in the Seoul and metropolitan area during this week, we believe that all of the daily routines of the public nationwide could become to a halt, and we could put at risk the health and safety of the high-risk groups, including those senior citizens. And we are highly concerned of a possible outbreak nationwide stemming from the metropolitan area, and there are people confirmed patients who are in the high age group, so we are also very monitoring the situation very seriously. And we note this another time, but unlike Shincheonji, we assume that this virus strain is GH, which is a high rate of infection. And we also note that the virus has spread fastly, even at a circumstance where a large amount of the public are aware of social distancing. And there could also be some unidentified sources of infection, and also there could be a possible risk of infection spreading to other regions across the country through worshippers and churchgoers. Of course, we cannot control the virus entirely. However, we also can decrease the scope and the rate of infections through testing and quarantine measures. And we can also heighten our vigilance as well. And these can be done with our own efforts proactively. We tell you this multiple times, but this is a very moment in time, and this is a very essential time. If we do not contain the virus going forward, we will have to inevitably raise the social distancing to level 3, which will put at risk many daily routines for individuals and also for a nation as a whole in terms of economic and socially. So first of all, it is very important that we trace down unidentified patients here in Seoul and metropolitan area and to decrease the rate of infections at high-risk facilities and facilities where there has been a large exposure to the virus, which has been summarized throughout my briefing, including the churches, also the Gwanghwamun rallies. We need all of you to get tested as soon as possible and get treated as soon as possible as well. So these are very essential. And the quarantine authorities will also keep an eye on the list of the participants given by our local authorities. And even now, the non-metropolitan area, which is deemed to have a lower risk of infection, we need to take preemptive measures for these places as well. And just like Daegu City, which carried out a briefing today, these local authorities also need to take bold and swift measures. The quarantine authorities will also exert our full efforts to minimize the damages caused by the virus and contain the virus. We had a series of challenges and crises during the past, and we were able to overcome them proactively with the wisdom gathered by our public. And once again, we ask the public, we need to contain the virus at this point, and we need to overcome this grave, serious situation. And we ask for you to carry out quarantine measures and level 2 social distancing. Thank you very much.
Right, that was Kwon Jun-wook, the Vice Head of KCDC, which used his afternoon briefing. So he touched upon local infections at a church here.
Yes, especially the Sarang Jail Church, which now has a total of 457 cases. So what's important right now is contact tracing and also that people get tested for the virus. So that's why the Vice Director of the KCDC asked for people who were in the region of massive rallies on August 8th and August 15th to get tested for the coronavirus so that these cases do not spread to other regions apart from the metropolitan area.
All right, so thank you for that. We'll see you again tomorrow.
See you tomorrow.
We turn now to neighboring Japan, where authorities have been tackling more than 1,000 daily cases in recent days. I have Hiroaki Wada, a senior writer at Mainichi Shimbun, live on the line with details. Welcome, Wada.
Thank you very much for having me.
Now, Wada, Japan recently marked an end to a long weekend holiday to commemorate Mountain Day, I hear. Please do start with the latest COVID-19 situation there.
Okay, thank you. We had a really high numbers of new cases in late July and early August, which is before the national holidays. And during the national holidays, the number decreased a little bit to several hundreds to up to 13,000 or so. So we are seeing a little bit of decreasing in the last week. And after the vacation, we don't know what will happen. We have to keep a close eye on that. And talking about the fatalities, the number of people who are dying is going down a little bit compared to during the emergency here in April and May, but we have to be careful here again.
Wada, was there a stark difference in the manner that people spent their holiday this year amid the pandemic?
Exactly, because warnings from the government and also self-restraint taken by a lot of people, we see a drastic decline in the number of people who are traveling during the holiday season. The number was 40% to 60% lower than the last year at major transportation hubs throughout the nation, including Tokyo. So when you have less number of people moving around, generally, you tend to have less number of infections. But nevertheless, a number of people travel during the holiday season, so we'll see the impact later this week or the next.
Well, I understand that thousands of couples have postponed their wedding while funerals have been scaled back. Could you tell us more about that?
Yeah, according to an industry organization which asked to more than 100 bridal ceremony locations nationwide, the number of cancellations and postponement for weddings was more than, as you said, 170,000, which is more than half of the total number of people who get married annually in Japan. And the industry suffered a big loss of some $6 billion a year. And as for the funerals, we hear a lot of stories of people refraining from attending them because they don't want to get all the people infected. And also there are cases of people postponing their grave visits, which is an important ritual for many Japanese people during the holiday season.
How is the public responding to government efforts to contain the latest contagion, Wada?
It's a good question, and a lot of people are getting frustrated because it's getting really long, and we are now having a second wave. And also, a lot of people are worried about economic downturn, which is reaching a staggering rate of annual rise of 27.8% for based on the numbers recorded in April-June period. The economy is picking up a little bit, but still people are worried. And there are some people so frustrated they are going out and having rallies calling for no mask, sessions, and it's kind of worrisome.
I see. One final question, Wada, before you go. There has been some speculation over Prime Minister Shinzo Abe's health. What can you tell us about that?
Yeah, as you know, the Prime Minister visited a hospital in Tokyo to receive, according to government officials, regular health checkups, but he stays there for more than 7 hours, which is triggering a number of speculations about his health. And he had to step down in part because of his health conditions when he had his first administration in 2007 after a major election loss. So, and that condition is said to have been stabilized with good medicine and other treatment. But because of the lot of pressure on him due to handling with COVID-19, a lot of people are worried and keeping a close eye on the development about his health.
I see. All right, Wada, thank you for making the time to join us live with your thoughts.
Thank you. Thank you very much for having me.
지금까지 위기 수위를 뛰어넘는 이전에 한 번도 경험하지 못한 위중한 상황이라고 말씀드릴 수 있겠습니다.
대규모 재유행의 초기 단계로 보이며 지금의 확산을 최대한 통제하지 않는다면 전국주인 전파와 환자의 급격한 증가로 인한 심각한 피해가 야기될 수 있습니다.
Following months of low infection rates, Korea now appears to be witnessing a fresh outbreak centered in the metropolitan region. For more on the events here, I have Professor Jong Gi-seok from Hallym University, who formerly served as the head of KCDC. Welcome, Professor Jong.
Thank you for having me.
And I also have Professor Lee Hun-sang from Yonsei University. Good to see you again, Professor Lee.
Thank you for having me today.
Professor Jong, we're seeing a disturbing rise in cases here in the metropolitan area linked to a conservative church. Now, authorities claim the total number of infections since last Friday stands at 991. How severe is the current situation, in your opinion?
I'm afraid it is getting serious. So when you see the number of total cases, it is increasing in a very rapid manner. If you see the curve, it shows exponential curve. That means that the increase is very rapid. And the other one is there are multiple clusters of infection, such as churches, restaurants, bars, and etc. So that means you can go anywhere, you can go everywhere, you can get an infection there. So if you cannot flatten the curve, then we might face medical resources shortage, and the epidemic intelligence service will be facing a big disaster.
I see. Professor Lee, as Professor Jong just mentioned, the authorities have also touched upon the alarming speed of the latest spread. What do you believe is the reason behind this rapid transmission?
It seems like there are many of different factors. First of all, there had been some speculations, as Dr. Kwon from Korea CDC said. Some of the latest virus types are like GR or GH, which has about maybe 6 times of the transmissibilities, because as the virus evolves, the toxicity decreases, but the transmissibility increases. But I think overall, the general level of alertness among the general public had been reduced quite a bit as the time progresses on. And also, I think there might have been some of the mixed message from the government, especially when the government was somewhat loosening the ban on the church gathering, small gathering, and things like that. So I think many of the people had been somewhat of a reduced notion about the seriousness of the disease, and also the possibility of the infection, as it had been shown in the recent survey. So I think it is a combination of many of those things.
I see. Professor Chung, there are concerns, like you mentioned, over the capacity to deal with escalating cases here in Seoul. Is the medical infrastructure in the capital city able to perhaps handle a sudden surge in cases, do you think?
Still, we have some vacancy, but already 75% of all hospital beds, which is available for COVID-19, is occupied. In number, less than 700 beds are remained for inpatients, and less than 90 ICU beds are remained. So if you have a continued increase of confirmed cases, we may be short of hospital beds. So having said that, we need out-of-hospital patient care facilities like a living treatment center. So we do not have to care the mild cases in the hospital. So we can save the hospital for more severe patients.
I see. Professor Lee, aside from places of worship, like Professor Chung earlier mentioned, recent cases also involve venues like cafes, outdoor markets, and retail stores. Do you suppose prevention efforts at these places had not been imposed properly, had not been enforced properly?
So I think we had been seeing quite really reduced level of general alertness among the general public, and I think we had been seeing just increased number of the people in those cafe and public and spaces, and that is not a good sign to begin with. And also with summers coming with the very hot weather, many of those cafes had been probably not opened and not well ventilated, with air conditioning pushing the air around within the cafes, possibly moving the virus, the air droplets further. So, and also what I had been noticing was many of the people would be wearing the mask outside, and as soon as they enter the cafes, they would not be wearing the mask and just begin talking. So I think many of those very basic precautions that had not been kept well. So I think there might have been some of the factors, and I think it is really important to really keep the distance even within the cafes, and also ventilate the cafes as much as possible, and possibly, if possible, as much as possible, reduce the level of air conditioning, especially the air speed, so that we can keep the virus spread much at the reduced level as much as possible.
Right. Right. And given the current circumstances, Professor Jong, as of this past weekend, social distancing measures here in the metropolitan area has been raised to level 2. For the sake of our viewers, could you please tell us a bit about the measures under this current alert level?
Yeah, there are several important points. First of all, the gathering things. So the 50 people, more than 50 people are not allowed to gather in indoor activities. For outdoor activities, more than 100 people are not allowed. But it is not mandatory so far, but the rule is that. And the other one is sports. You can continue baseball and soccer, but without spectators. That's for level 2. And there are many high-risk facilities which government has already designated, such as Hagwon, more than 300 students, and bars and karaoke, and etc. It is mandatory to close in level 2, but are not on operating and so far. And the other one is schools should consider online only, but you can do online and offline both, but you can consider online only class in level 2.
I see. Professor Lee, also in response to the latest events, as Professor Jung just mentioned, schools in parts of Seoul and in Gyeonggi province have closed doors. I suppose this measure comes as part of efforts to contain a possible spread within the academic arena.
Mm-hmm. Yes. I think there is the risk of the infection, the COVID-19 spread in the school, especially right now, even the government is keeping the level 2. I think what we are seeing is having the cases over 100 cases per day. I think we are, in a way, entering into the level of the level 3 at this moment. So I think it is quite an important time about considering possibly moving to online. But it's really difficult situation because it's not going to be a short battle, and it's going to be very long, extended fight against the COVID-19. And many of the students who are behind, and also students from the very poor family might be left behind. But I think what is really important is to reduce the pressure of the infection spread. So at least I think we have to really reduce the class size. Already some of the schools are reducing their class size to 1/3. And also based on any of the changing situations, I think it is really important time to consider even going on to online as well. So I think it is very important time.
Right. Professor Jung, what are your prospects with regard to the latest outbreak? As Professor Lee just mentioned, are you also thinking about the possibility of level 3 announcement? Now, this is something that the government has also touched upon.
Yeah, nobody knows very near future what happens. But before we are considering level 3, I like to ask local and central government to perform reinforcement their already made policy. I like to recommend the more strict enforcement or an implementation of punishment. Even though we are in level 2, they are not doing the level 2. They are not acting like level 2. You have to stop all the high-risk facilities before you are considering moving up to level 3.
I see. So there needs to be more legal repercussions on those who don't abide by measures under level 2.
Yes.
Professor Lee, starting from this Monday, foreign nationals who violate measures related to containment efforts will be required to shoulder the entire cost of their treatment here. Now, this also, I suppose, comes as part of the government's efforts to better tackle the latest spread. Please tell us more.
So I think while the community transmission is going on within Korea, I think the situation is happening not just in Korea, but in many other countries right now. As it had been said, we are seeing increase of the case in New Zealand and Australia and Vietnam, and also in India and Indonesia, we are seeing increase of the cases. And the cases are still at a very high level in the United States. And also in Europe, in Italy and Spain, we are again seeing some of the increases. So I think it is a really important time to really keep the quarantine and also screening measure at the very high level for incoming traveler as well.
Right. Professor Chung, as Professor Lee just pointed out, this appears to be a global trend, the resurgence. It's not just something that Korea has been exposed to. Amid this climate, what are some words of practical advice that you would like to share with the citizens here in the capital city amid the latest outbreak?
I have to say that let's get back to the basics. So when you feel difficulty, you have to remember the basics, the individual quarantine principles, like wearing masks when you need, when you have to, everywhere and every time. And please reduce the number of gatherings. Avoid unnecessary gathering. But if you have to, if you cannot avoid it, please reduce the staying time over there. That's the only way to avoid all the virus exposed to you.
Right. And Professor Lee, you've been hinting at perhaps we are witnessing the result of our complacency with regard to prevention efforts, of course, in the absence of a vaccine or a cure. What should we seek to remember to ensure our health amid this latest outbreak?
So again, I think we go back to the basic, as Professor Jung said, and reduce gathering as much as possible. But also, I think what is also important is also keep the basic precautions, especially wearing the mask. Not just to protect yourself, but also just in case that you might be infected, to protect others as well. And also, I think it is very important for people who are above 65 years old with diabetes and other pre-existing condition. I think maybe within next 1 or 2 weeks, I think it is very important time that they should be very careful and if for every citizens, for all the Korean citizens, if you want to help the medical personnel and the public health personnel, I think the best thing that you can do is just stay home.
Right. Thank you for your words. All right, Professor Lee, thank you for being with us today. And Professor Chung, as always, thank you for your thoughts.
Thanks.
Thank you very much.
Right, well, that brings us to the end of Tuesday's edition of COVID-19. Tomorrow, we bring you more details on the coronavirus mutations and efforts to develop an effective vaccine amid the resurgence of the virus worldwide. In the meantime, do stay safe and do stay away from crowds. See you tomorrow.